5. Best bedtime vitamins. Every senior should take for stronger legs. Did you know that 80% of leg problems in seniors actually come from vitamin deficiencies? It's not just about getting older or not moving enough. The real issue is that the nerves, blood vessels, and muscle tissues in your legs are slowly breaking down from a lack of key nutrients. Are you feeling numbness, nighttime cramps, knee pain, unsteady walking, or cold feet, even when it's not cold? Don't ignore these signs. They could be the early warnings that your legs are quietly deteriorating from within. After 60, your legs become one of the most vulnerable parts of your body. They carry your full weight, and their strength depends heavily on good circulation, a healthy nervous system, and strong bones and joints. Without the right nutrition, your legs will gradually weaken, making it harder to walk, causing loss of sensation, increasing your risk of falling, developing foot ulcers, or even leading to amputation due to blood vessel damage. I'm Dr. Sam Wells, 50 years old, and I specialize in senior health in the U.S. In this next part, I'll walk you through the 5 most essential vitamins that help keep your legs strong, flexible, and free of pain, even well into your 70s or 80s. Stick with me until the end, and don't forget to share this video with your loved ones, friends, and subscribe to the channel so you won't miss vital tips for healthy aging. 1. Vitamin D3. Do you know how many seniors end up bedridden each year because of a seemingly minor fall? It's not because their legs suddenly gave out. It's because their bones had silently become fragile over the years without them realizing it. One of my 72-year-old patients once told me, "I still walk every morning, still take care of my garden, but just one misstep on the porch stairs and I broke my hip." What hurts me most is knowing that fall could have been prevented with one simple habit: getting enough vitamin D3 every day. Vitamin D3 isn't just the sunshine vitamin, it's your leg's silent protector. It helps your body absorb calcium effectively into your bones, especially in crucial areas like the knees, femoral neck, and hips. Without D3, no matter how much calcium-rich milk you drink, most of that valuable mineral just passes through your system. I like to think of vitamin D3 as the gatekeeper. It opens the door in your intestines so calcium can enter your bloodstream and then get delivered to the bones that need it most, especially your leg bones. After age 60, our bodies naturally absorb less D3 through the skin, especially if we don't get much sunlight or live in places with long winters. That's why osteoporosis is so common among older adults in the U.S., even when their calcium intake is high. Have you noticed your legs feeling weaker, even though you're eating well? Do you experience back pain, stiff knees, or find yourself slower to get up from a chair? Those signs may not just be aging. They could be your bones losing density because you're not getting enough D3 to support them. A large European study found that seniors with low D3 levels were twice as likely to suffer hip fractures compared to those with adequate D3. This becomes even more serious in postmenopausal women, where lower estrogen speeds up bone loss. I once treated a 68-year-old woman who fractured her hip just by bending down to tie her shoes. She had no idea she was severely deficient in D3 for years because she didn't feel any major symptoms beforehand. Don't let your body fool you. A D3 deficiency doesn't come with pain, fever, or bruises, but it silently chips away at your bones every day. And then one day, with just a small slip, you're not just injured, you could lose your ability to walk forever. So how do you know if you're getting enough D3? A simple blood test will tell you. But even without testing, if you rarely get sun, have darker skin, are older, or have digestive issues, your risk of D3 deficiency is already high. D3 can be taken as pills, drops, or in combo with calcium and vitamin K2 for better effect. But how much is safe? That depends on your individual needs, and you should consult a doctor. In general, most people over 60 need between 800 and 2,000 IU daily, depending on their health condition. Now I want you to imagine this. You wake up one morning, stand up from bed with steady feet without needing to grab onto the table without fear of falling. You walk out to your garden, your knees don't crack, your back isn't hunched. You're able to do this not because of luck, but because you chose to protect your bones, starting today with one small habit that could transform your aging years, taking vitamin D3 regularly in the right amount and in the right way. Remember, age doesn't take your legs away. Lack of care does. And care begins with knowledge. Don't wait until the doctor tells you you've got severe osteoporosis. Start today. 2. Vitamin K2. Did you know there's a vitamin that works quietly like a traffic controller inside your body? Not as loud or popular as vitamin C or D3, but without it, calcium. The stuff you're trying so hard to take for strong bones can accidentally turn into a traitor, building up in the wrong places and harming your legs. That vitamin is K2, and it's absolutely critical for your blood vessels and lower body circulation. I once treated a 74-year-old man who came in complaining about sharp pain in his feet. He didn't have diabetes or any injury. When we did an ultrasound of his blood vessels, we found that the small arteries in his lower legs had hardened due to calcium buildup, making it hard for blood to flow properly. He was shocked. I drink milk every day and get enough calcium. How can this happen? Sadly, the answer was clear. He was lacking vitamin K2, the nutrient responsible for guiding calcium to the right place in the bones, not the blood vessels. K2 doesn't create calcium, and it doesn't directly build bone density. What it does is make sure calcium doesn't end up where it shouldn't. It activates a protein called MGP matrix GLA protein, which helps sweep away misplaced calcium from the artery walls, especially in the legs, an area that tends to harden with age. Without enough K2, calcium can settle in the blood vessels, making them stiff and narrow, leading to plaque buildup and blockages. The result? Blood can't reach your feet properly, causing sharp pain, cold feet, numbness, and in severe cases, even tissue death, or the need for amputation. Just imagine. Your once nimble legs now feel heavy. Every step is awkward. You can't enjoy a walk with your grandkids, climb stairs, or even stand long enough to cook. And this isn't just aging. Sometimes it's the quiet damage from years of missing K2. A study of 800 older adults in the Netherlands showed that those with adequate K2 had up to 52% less arterial calcification than those who lacked it. That's a huge number. And in my own practice, I've seen many patients experience significant improvement in leg circulation once we added vitamin K2 to their routine alongside D3 and calcium. You might ask, I already take calcium. Do I really need K2? The answer is yes. Without K2, calcium can be a double-edged sword. D3 helps your body absorb calcium into the bloodstream, but K2 makes sure it gets to the bones, not your arteries or your heart. That's why today, when we design bone health plans for people over 60, we always recommend using the trio D3, K2, and calcium together. Vitamin K2 is found in fermented foods like natto, a traditional Japanese fermented soybean dish, aged cheeses, egg yolks, and animal liver. But most Western diets don't have much K2. That's why for older adults or anyone who rarely eats fermented foods, taking K2 supplements is a smart move. A common daily dose is 90 to 120 micrograms, and it's best to choose the MK7 form. It's more easily absorbed and lasts longer in the body. I'll never forget what one of my 80-year-old patients told me after he'd been unable to walk due to leg pain. He said, "Doc, just being able to go outside and feel the sun again makes me feel alive." With the right combination of knowledge and nutrition, we can help people like him get back on their feet. No surgery needed, just better habits. Remember, strong bones aren't enough. Your blood vessels need to be healthy too to deliver nutrients to your legs. K2 is the key player you shouldn't overlook. If you're already taking calcium or D3 but not K2, think again. You might be on the right path but missing a crucial companion. 3. Vitamin B12. Have you ever woken up in the middle of the night with your feet tingling like ants crawling, or felt like your legs were numb and unsteady when you stood up to walk? If so, that's not just aging. It could be a sign that your body is lacking something vital. Vitamin B12. I specialize in treating nerve-related issues in older adults, and I'm often surprised by how many patients suffer from numbness or strange sensations in their feet without realizing the root cause is a B12 deficiency. I remember a 68-year-old woman who came in because her left foot constantly felt like it was being shocked and freezing at night. Even when she wore shoes, she couldn't feel the ground beneath her. Blood tests showed her B12 levels were only half the minimum needed. Vitamin B12 is essential for your nervous system, especially the peripheral nerves, the ones that carry messages from your brain to your hands and feet. When you're low on B12, the protective coating around your nerves called the myelin sheath breaks down. That causes signals to travel poorly or incorrectly, leading to numbness, burning, stinging pain, or even total loss of feeling in your feet. This isn't just uncomfortable, it's dangerous. People can trip, fall, or injure themselves without even realizing it. In older adults, absorbing B12 from food becomes harder because stomach acid levels drop with age. Diabetics who've been taking metformin for years are also at high risk of B12 deficiency without knowing it. What's worse is that if B12-related nerve damage goes on for too long, it may not fully recover even after supplementation. A study from Oxford University found that 40% of people over 60 have lower than normal B12 levels, and more than half of them show signs of nerve damage in their legs. These individuals face a much higher risk of losing balance, walking difficulties, and falling, sometimes resulting in serious injuries like broken bones. B12 also helps make red blood cells and prevent anemia, another factor that affects leg health. When there's not enough oxygen in your blood, your legs feel heavy, cold, and cramp up easily during walks. So what should you do? First, pay attention to signs like tingling pins and needles, that thick sock feeling even when barefoot, or a loss of touch sensation in your feet. If you notice any of these, get your blood tested for B12 levels. You can get B12 from beef liver, red meat, tuna, salmon, eggs, and dairy. But older adults and vegetarians need to be especially careful since absorption may be poor or food choices limited. In severe cases, doctors may recommend B12 injections to quickly restore levels. Most people take between 500 to 1,000 micrograms per day depending on their needs. Some take B-complex supplements for overall nerve health, but if your main goal is to fix foot sensation issues, B12 should be your top priority. I once saw a 72-year-old man who, after 3 months of proper B12 supplementation, was able to go grocery shopping on his own again, climb stairs, and most importantly, sleep through the night without his feet waking him up. That recovery wasn't just about pills, it came from recognizing the role of a seemingly small vitamin. Remember, strong bones and muscles are not enough. Your nerves need to be sharp too. Vitamin B12 is like the electricity that keeps your feet alive and moving. Don't let numbness steal away the freedom that comes with age. If you found this content helpful, please share the video with someone who might be going through the same thing. Subscribe to Wellness Unfolds to keep learning practical health insights from me, Dr. Sam Wells. Together, we'll make sure every step in your golden years stays strong and steady. 4. Vitamin C. Have you ever noticed a small scratch on your foot taking way too long to heal even though it was just a light scrape? Or felt a dull ache in your ankle or toe joints every time the weather changes? Don't rush to chalk it up to aging. You might actually be missing an important bodyguard, vitamin C. As a doctor specializing in foot and vascular health in older adults, I often see a direct link between joint inflammation, stubborn foot wounds, and low vitamin C levels in the blood. One of my patients, a 67-year-old man, complained that a tiny scrape on his sole took over 3 weeks to heal. When we tested his vitamin levels, it turned out he was severely deficient in vitamin C, something he never suspected because he thought eating fruit daily was enough. Vitamin C plays a central role in collagen production. The essential component of connective tissue that helps wounds close quickly, keeps skin-elastic joints flexible, and blood vessels strong. When you're low on vitamin C, your tissue repair slows down. The tiny capillaries in your feet become fragile, which can lead to bleeding under the skin, easy bruising with movement, or even just after a long walk. This is especially critical for seniors. The soles of the feet take constant pressure with every step, and maintaining capillary strength is key to preventing foot ulcers, a serious risk for people with diabetes or poor circulation. Vitamin C is also a powerful antioxidant that helps reduce joint inflammation. That's why folks with chronic arthritis in their ankles or toes often feel better when they start supplementing vitamin C regularly. A study from Tufts University found that older adults with higher vitamin C levels in their blood healed wounds twice as fast as those who were deficient. Plus, their joint pain and swelling significantly decreased after just 6 weeks of supplementation. Vitamin C doesn't just support soft tissue repair, it also boosts iron absorption, which is essential for producing healthy blood. That matters because oxygen needs to reach the muscles and nerves in your feet. Iron and vitamin C work together like a perfect team to regenerate and nourish tissue. Here's the catch, though. Our bodies can't produce vitamin C on their own, and many older adults eat fewer fresh fruits and vegetables. To make matters worse, certain stomach medications and chronic digestive issues can interfere with absorption. So the risk of vitamin C deficiency is more common than you might think, even if your diet seems okay. You can get vitamin C from guava oranges, grapefruit strawberries, kiwi kale, and broccoli. But if you don't eat enough produce every day, taking a supplement of 500 to 1,000 milligallons per day might be a smart move. It's best to take it after meals to avoid stomach irritation and look for formulas that include bioflavonoids to improve absorption. I once treated a 74-year-old woman with chronic ankle arthritis. Her joint was red, swollen, and persistently painful. After 8 weeks of vitamin C supplementation combined with anti-inflammatory foods, the pain significantly eased, her walking improved, and she could stroll around the park each morning without her cane. Healthy feet don't just rely on strong bones. You also need resilient skin, sturdy blood vessels, and flexible joints. Vitamin C is the key that helps protect your feet from slow, silent damage you may not even realize is happening. 5. Vitamin E. Do you often have cold feet or bluish toes even when the weather isn't that cold? Or get leg cramps in the middle of the night that jolt you awake and make it hard to fall back asleep? These aren't just signs of getting older. They might be warning signs that your body is lacking an essential vitamin E. Most people know vitamin E as something that's good for the skin and slows down aging, but its role in foot health doesn't get talked about enough. As a doctor who specializes in circulation and peripheral nerve health, I see many older patients with cold feet, blood vessel spasms, or tingling sensations in their soles, and they rarely suspect it could be due to low vitamin E. Here's what you need to understand first. Vitamin E is a powerful antioxidant that protects cell membranes from damage caused by free radicals, those unstable molecules that destroy cells and speed up tissue degeneration. When free radicals attack blood vessel cells in the feet, the aging and hardening process accelerates, reducing circulation to the toes and soles. That's why your feet feel colder, your skin looks pale or bluish, and you get more aches and fatigue when walking. Vitamin E also helps keep blood vessels elastic and improves blood flow, especially in the tiny capillaries in your toes, areas that are easily blocked in older adults or people with diabetes. By softening vessel walls and preventing platelets from clumping, vitamin E lowers the risk of small clots forming, which can cause sharp pain, numbness, or sudden muscle spasms in the legs. One of the earliest signs of poor circulation in the legs is nighttime cramps. When muscles don't get enough oxygen during rest, they're more likely to contract suddenly. Vitamin E supplementation can help improve circulation, reduce how often and how severely cramps occur, and help you sleep better through the night. Vitamin E also protects joints from the wear and tear caused by inflammation and oxidative stress, the two main forces behind early joint degeneration, especially in the ankles and feet. These joints bear your body weight every day. By reducing inflammation and neutralizing free radicals in the joint fluid, vitamin E helps keep your movements smooth and pain-free. One study published in the American Journal of Clinical Nutrition showed that seniors who took vitamin E regularly had better peripheral circulation, less numbness and cold sensations in their hands and feet, and significant joint pain relief after just 6 weeks. One of my patients, a 72-year-old woman who struggled with nightly toe pain and coldness, saw an 80% improvement in her symptoms after taking 400 IU of vitamin E daily, along with a diet rich in healthy fats. Natural sources of vitamin E include almonds, sunflower seeds, olive oil, avocados, and spinach. However, many older adults eat less fat due to cholesterol concerns or absorb less because of declining liver and gallbladder function. That's why in many cases a supplement of 200 to 400 IU per day may be necessary under a doctor's guidance. One important note: if you're taking blood thinners like warfarin or aspirin, don't take high doses of vitamin E unless your doctor says so, because it can increase the risk of bleeding. But if you're healthy and take it at the right dose, it can do wonders for your foot circulation and help slow down joint aging. Think of vitamin E as an invisible oxygen tank that quietly helps your feet function better each day. If you're dealing with cold feet, aching soles, or a slight loss of feeling in your toes, it might be time to check your vitamin E levels and adjust your diet or supplementation accordingly. Don't let today's small symptoms turn into tomorrow's big problems. If you truly want to protect your feet after 60, the 5 vitamins we've covered are your solid foundation. Vitamin B12 supports nerve-muscle coordination, reducing numbness and improving foot sensation. Vitamin D3 helps absorb calcium, reduces joint inflammation, and boosts leg strength. Vitamin K2 directs calcium into the bones, not the blood vessels, protecting your feet from dangerous blockages. Vitamin C speeds up wound healing and eases toe joint inflammation. And vitamin E gets the blood flowing to the farthest tissues, easing cold feet cramps and premature joint aging. When taken at the right dose and time, combined with 3 simple habits like staying hydrated in cycles, eating light dinners, and doing gentle evening movement, you'll feel a difference in just a few weeks. Less pain, less numbness, and more stable steps. The problem isn't your age. It's how you care for your body each day. And now's the time to ask yourself, am I getting enough of these vitamins? Am I doing the right things to support healthy feet for the long haul? In the next video, I'll show you how to choose natural foods rich in these vitamins and share safe, effective tips for seniors. If you found this content helpful, share it with someone you care about and hit subscribe too. Wellness unfolds, so you won't miss the valuable health knowledge I'll continue to bring you. Thanks for watching, and I'll see you in the next video.